for the remaining talks for this track, but for this first one, we'll only have one talk. So yeah, but after this first presentation that's coming in right now, we'll be having 2 rooms, and I will share the link to join the second room in case you're interested, and the title of that presentation right after this presentation has ended. Yeah, and also just a quick reminder, even as I'm going to introduce the next speaker, and even as the tech team shares the slides of the next speaker, if you have any questions as well, just post them on chat. We have people who are monitoring everything that's coming in. If we'll have time, we'll be able to answer those questions during the call. If not, the questions will be answered afterwards. Yes. So for the next presentation, we are going to have Zacharia Muindi, who is a lead mapper at Kibera Trust here in Nairobi, Kenya, and he'll be presenting on their project in fighting COVID-19 in Kenya. Without taking much more time, Zach, you can go ahead and start.
Thank you so much, Nora. Hi, everyone. My name is Zach. I work with Kibera. I'll be sharing the work that we've been doing here in Kenya, particularly in response to COVID-19. In tracking cases and also resources, mainly in Kibera and other informal settlements. So next. Next, please. Yeah, sorry, yes. Can just go back. Just go back one slide. So maybe as he prepares, on 13th of March 2013, Kenya reported its first case of COVID-19. And there were a lot of projections that were being done about how spread of the disease and how the disease will spread out in the country and the number of people who may end up being affected. And Kibera was not spared in this case, as it was projected to be one of the areas that would be highly affected. And there were a lot of articles that were written and a lot of stories that were covered, mostly in Kibera. One interesting story that was being done by BBC showed the story of a man who was talking about the whole issue about social distancing, and they were saying how this is nearly impossible in places like Kibera, and he was giving an example of his own household. He has a family of around 5 children, and him and his wife, so that brings to a total of 7 people in one household. And he was explaining how this will be a challenge, especially with the regulation that were coming in the government, that people need to keep social distance. And he was explaining how this will be hard in a situation, in a place like Kibera. And there were a lot of other factors that were being given, why Kibera might be one of the most affected area, considering things to do with most people from Kibera do not have like access to clean water, mostly in their houses. So how it works is get water, or they buy water from vendors who provide the water from the street. So they just have to, they don't have water in their houses, so they have to get it from outside. And this will have proven to be a challenge, especially when people are being reminded to always make sure that they clean their hands like regularly. So this was also was proving to be a challenge in place like Kibera, and also how people live like as a community. Is that like constant interaction between people? So again, the issue of social distancing was going to be a challenge. And I think these are some of the factors that were being put in place and projecting that Kibera may be one of the most affected areas. Next slide. So what you realize is, yes, there were these factors that were being shared and just projecting how Kibera will be affected. But over the time, we realized this was not the major problem that people in Kibera were facing. One of the things that we noticed after the first case was reported, before, like from the social media and people seeing news from other countries and how the disease was affecting people, there were a lot of myths that emerged over a period of time, and there was a lot of misinformation that was going around, and we realized this was also happening in Kibera because of how the place is. This information was spreading very fast, and we thought, yes, these other things that may affect people of Kibera, but we realized this misinformation that was going around may prove to be a bigger challenge, because considering there was some misinformation that was going around, like if you take garlic and ginger, and then that could possibly maybe cure COVID, and we thought this will prove to be a problem because people tend to lean on this side of information. Then that means they will neglect other regulations that are being given by the government. So that means if I take garlic and ginger, then that means I don't need to wear a mask. I don't need to clean my hands all the time. So because at the end of the day, I'll just continue with my normal life. And if anything happens, then I have at least, I'm sure there's a cure that is out there in the name of garlic and ginger. So we release all this kind of misinformation. And that's why in partnership, next slide please, in partnership with Ushahidi, we launched the Kenya COVID-19 tracker. The aim of launching this Ushahidi instance was to mainly track the cases that were being reported by the Ministry of Health on a daily basis, so that we also ensure that people from Kibera can be able to access this information. So those who maybe didn't get a chance to maybe see the briefing that were being done on a daily basis, then at least they had like a place where they could be able to get access to this information. But apart from that, we're also trying to map out resources that were being provided by different NGOs and other well-wishers. So one thing that happened in this period, there was a form of resilience that emerged from the community, because this problem was already there. So the community through different organizations, through different community-based organizations and youth groups, people came up with different initiatives to support the community. And there were different organizations that were putting up hand wash facilities. So that was in a way solve the problem of access to clean water. So there are hand wash points that were placed in different locations in Kibera, where people could be able, like, mostly like where there's huge traffic, especially when people are going to work and coming back in the evening. So the hand wash points were placed in strategic places so that people can be able to access, like, on a regular basis, like clean water and soap to wash their hands. There are also drives, food drives that were being done by different organizations. So there are well-wishers who would like to support the community, but because they don't know the area very well, they will work through the organizations and provide food. And then this organization will put up set up locations where the community could be able to come and get like any kind of support in terms of food. And then there are other organizations that were doing mostly like sensitization, just doing a lot of sensitization, going around the community through public, using public address systems, and just sharing more about the disease and what community needs to do to at least curb the spread of the disease, and also see the curve within the community flatten. Next slide, please. Yeah, so as I shared, so the just as one slide, yeah, thank you. So as I shared, the platform was basically to serve as a hub to provide the community with real-time updates on what's happening within the country and also the community in regards to COVID-19. So we were crowdsourcing like information from different media channels, both international and also local media channels, just putting together all the articles and news that were coming out about COVID-19, so people can be able to access this information in a central place. And also, as I shared, we were also on a daily basis posting like the cases that were coming in, being reported by the Ministry of Health. So we used to get like a lot of feedback from the community where they were trying to inquire like just getting to us like how many cases have been reported on that day and how many cases were being reported from Kibera. Then we also providing other reliable information. So over the period of time, as I mentioned, there was a lot of misinformation. So the Ministry of Health also came up with other ways of passing information, like in form of posters, so able to like cap the misinformation that were going around and just trying to emphasize and create awareness to the public, like if in the case of like the myth about the garlic and the garlic and ginger being a cure. So there was that information that is not true. So when we are sharing this information, the community could be able to know that indeed this was not true. So they get like the right information. But also at the same time, you also reaching out to organizations to share and to post the work that they are doing. The reason also we are doing this is we realized there was a lot of when it came to the resources that were being provided to the community. Most of it tend to lean on one side of the area, so you find like another part of the area, like in Kibera, we're not getting like these resources. So the reason why we also are doing this is just to ensure that the organization can be able to see what are some of the initiatives that have been placed in a certain area. So instead of doing the same thing and duplicating the work of the other organization, then they can be able to see in terms of distribution within the area. They can be able to tell that this area has more hand wash points, so there's no need to put hand wash points in this place. So what we can do is just maybe put hand wash points in other places. And over time, we saw like more organization coming in and the resources getting distributed over a period of time. So you find like areas that had not been did not have like hand wash points, they were able to, like the resources now were well distributed in the area. At the same time, we also launched our WhatsApp broadcast where we were sharing this information that we are getting from the platform and sharing it to the community so they can be able to get the information. Not just they can't visit the site, and then they can be able to get the information directly on their phone. Next slide, please. Yeah, so this is just basically like a small analysis of the number of posts that have been coming on the platform. So you can, as you can see, we have like the blue one is the confirmed positive cases, which has been in the high, and as you can see, the numbers keeps rising. Below the other posts that have been coming in, like recovered cases, resources. So you see the numbers are a bit low compared to the positive cases that are being posted on the platform. Next slide, please. Next. Yeah, so around June, we applied for the rapid response microgrant that we were lucky to get, and this really helped us to expand to other informal settlements like Madare. And so we were able to carry out the same exercise and expand it to other locations. So in this case, this is the Madare because that have been reported post both resources and cases that have been reported in that area. Next slide. Yeah, so also because of the regulations that have been put in place by the government, we realized people are now at home. So during the project, we also conducted like several remote mapping trainings. So we trained different youths from Kibera and also Madare and Mkuru. We were just training them on how they can be able to contribute to OSM remotely without having to go to the field. And we saw quite a number of people attending the training. So we focused mainly on the health facility, where we're training them on how to add health data using health sites. We also did some mapping on security lights and also did some updates on OSM in different data. Next. Also, in partnership with Ushahidi, we have also been able to conduct some trainings, both in Kibera and Madare, where we've also been training the organization that we are working with. Now they can be able to continue posting the work that they are doing, the initiative that they are carrying out in the two locations. So just training them on how they can be able to access the information and how they can be able to make use of the information that is on the platform, but also at the same time also posting the work that I've been doing. So the photo you're seeing on the left is one of the participants just trying to, from one of the organizations, trying to post the work that they have done in the community using the mobile app to post their work on the platform. Then on the right, that's a group photo of the participants who attended the training from different organizations in Kibera. So the other thing that we also did, we partnered with UN Habitat. They carried out a mapping exercise in Kibera, in Madare, where they were mapping out like different facilities. So they are doing like a small research, and part of it was mapping like facilities in Kibera and Madare. So the data that they collected, they willingly gave us the permission to post, to upload, to import the data into OpenStreetMap. So through the exercise, we were able to update some of the features in Kibera and also in Madare, and we also got a chance to do areas that is Kawangware and Kisumu. I've been told my time is over, so maybe I'll just jump to the questions. Sorry about that.
Okay. So yeah, because of time, I will just jump right into the questions. You got a number of questions. So the first one was by Innocent Maholi, who's asking, was there any support from the government, or was there an interest from other institutions, organizations, and especially the government for this project and the data that you are collecting and had it on the dashboard? Was there any interest?
I would say when it comes to government, we haven't had like any interest coming from the government, but we've seen other organizations coming in Kibera, just requesting for just to get to be able to use the information that is on the platform. So there's one that reached out to us, so they just wanted to see, be able to access the information, and they are doing like an analysis of some of the support or initiatives that have been put in Kibera, and just trying to understand what has been done so far, what other needs are missing in the community. So we we have seen interest from other organizations within Kibera who have just been coming and requesting for the data, but also from the same organization that we've also been reaching out to. So they've been able to use the information to be able to see where not to duplicate the work that other organizations are doing. So the information they've been able to see where other need and be able to focus on another area instead of duplicating work in the same area. But from the government, we haven't had like one as for now. But we are hoping maybe by next year we will start doing some follow-up with some of the government officials that we've been able to be in touch with over the period of time. Yeah.
Okay, Innocent, I hope that was answered. Then just lastly, before we skip to the next sessions, we had a question from Pete Masters, and he was asking, do you have any evaluation data that you can share? And if not, is this something that you plan to do in the next future?
So I think at the moment we don't have one, but coming next year we are planning to do one. So I think once this has been put in place and we've done something, then we'll be willing to share. So at the moment we haven't done one, but we'll be sharing more come next year. So there's something that there's some work in the pipeline that we are trying to. There's a project that's coming in next year where we'll just be trying to do like a study on some of the impact of COVID-19 to economic impact to the community as a result of COVID-19. So once that is out, we'll be willing to share it out. So at the moment, not yet.
Okay, thank you so much. Thank you so much, Zach, for that amazing presentation. It's always amazing to see the impactful projects that Kibera are conducting. So as we move